interesting show. Chiropractic Solutions, and we're going to talk about fibromyalgia. So if you are experiencing anything that could be related to this, or you've heard this, or have a friend, you're going to want to watch this show. It's going to be very interesting.
I want to find out more about it.
So stay tuned. We'll see you in a few.
And we're back. We're here now with Dr. Regina Hendrickson of Chiropractic Solutions right here in Stockbridge. And Regina, welcome to the show.
Thank you.
Let's start off by telling our viewers a little bit about your location and a little bit about your background.
Okay. I am Chiropractic Solutions, and we are located I-75 off exit 228, and we are across Route 138 from the Coles and the Garden Ridge, and a little strip mall called Stockbridge Village.
And how long have you been in practice?
I've been in practice for, well, I graduated chiropractic school, Life University, in 1999, and I've been practicing since that. I practiced with other doctors while I was having 2 children, and 2 years ago we opened Chiropractic Solutions.
You know, many people are affected by fibromyalgia, and that's today's focus of the show. Can you tell us about it?
Of course, of course. Well, statistically speaking, about 4% of the population is affected by fibromyalgia. 90% of those are females and 10% are males. In my belief, there's a lot more males out there, but they're just not going and pursuing what their symptoms are. So there's a lot more males in the whole scheme of things. But realistically, there's no one specific lab criteria that people can go to the doctor and just get blood drawn and come back with a diagnosis of fibromyalgia. There's actually 2 criteria that doctors use in order to provide this diagnosis. And one of them is pain all over your body for a period of 3 months or more, and the second one is 11 out of 18 specified tender points on your body. And then when these are confirmed, a diagnosis of fibromyalgia can be given.
And what are they saying causes this?
They're really not sure. It ranges anywhere from a different toxin that can be in your body, and some groups get real specific that it's one specific toxin, stress-induced, and the list just goes on and on. So they're really not sure what causes it.
Can you give us an idea as to these different 11 points maybe that we should keep an eye out for?
Sure, well, they're just real tender points, and if you have them, you'll know because your body just aches, but it's behind the head, right by your collarbone. They are on the inside of your knee, the inside of your elbow, and there's some along the spine.
So if you're experiencing any of this, it could be fibromyalgia. So you said you cannot just walk into the doctor's office, draw blood, and be diagnosed with it.
Right. No, it's actually a very long process that goes on before someone gets a diagnosis of fibromyalgia. Most patients suffering from fibromyalgia will go about 5 to 7 years, and they'll see about 10 to 12 different doctors before they get the diagnosis. So it's really a hard thing to get diagnosed. And the reason why it's so hard is because there's a lot of other symptoms that go along with fibromyalgia, and they're not all the same. So sometimes, you know, aside from just having the achiness all over your body, people will have headaches, some as severe as migraines. They can get lightheaded and dizziness, jaw pain, joints aching. In the morning, their hands could be swollen, and they have a really hard time even opening and closing their hands. They have digestive problems, so they can range anywhere from just having to go to the bathroom all the time and having it be really loose to not being able to go at all. And it can switch back and forth. And the problem with all this is that it comes and goes. The biggest symptom that most fibromyalgia sufferers complain of is something called fibro fog. And it's like there's just this fog over them. They can hear you talking, they understand what you're saying, but for some reason they're just not processing it like they used to. And then when they talk, they're sitting there saying, I'm not getting out the words that I want to get out. So they're kind of walking around in this fog. And that, of course, makes everything that they do very, very, very frustrating.
You mentioned that there's more men out there that very well may have this.
Right.
And there's probably more in general. Is it a new diagnosis?
It's not necessarily a new diagnosis, but the reason why I had mentioned that there's a lot more men is because women tend to pursue what's going on with them a lot more than men do. Men are typically the providers, and you know they don't want to be
just get busy.
Yeah, they don't want to be let up at home or anything.
No, they don't
so
want to go to the doctor anyway.
Right, who does? Who does?
Yeah.
So you know they just keep going on with their life and pushing the pain aside and ignoring it a lot more than women do.
Which brings us here today. You have a treatment for this, and you're saying the patients are really seeing results.
They really, really are. And you know, one thing that I love about working with fibromyalgia patients is generally by the time that they come in, they've been run through the mill. They have seen doctor after doctor. Like I said, it's about 10 to 12 doctors that they'll see before they even get their diagnosis. And once they get their diagnosis, then, you know, there's like this relief, like, oh my goodness, I am not crazy. Because, you know, after so long, their families start, you know, saying, nothing's wrong with you, because their lab tests are coming back negative, and, you know, all this other stuff is coming back negative.
But they're feeling the pain all along.
All the time. It's just, it's miserable. They're not, like I said, with the fibro fog, they can't comprehend everything going on around them all the time. And so they're just like elated in a way to have this diagnosis. But then a whole nother realm starts. Because what happens is they're going to start pursuing, I have fibromyalgia, now I can get help. And what they're finding is nobody really knows how to help these patients. So what happens is they come in and, you know, we talk to them. And that's one thing that most of the patients who come into the office love, is that I listen. They will tell me everything going on with their health from point A, you know, all the way through until that day. And we get a very good comprehensive understanding what's going on with them. Because most people don't have the time to do that, but it's mandatory for me to spend that time with them to really get a thorough understanding. And what we do is then we do a physical exam. And we check out where they are physically, if they, you know, how much they could bend and move this way and that way. We check all their tender points and find out how tender they are. And then we put everything together.
You put everything together. And when we come back in the next segment, let's talk about the putting everything together and see, and actually you can explain from a patient from when they first came in until the time that I guess the treatment or the therapy would be over. So when we come back, we're going to learn this process, so stay tuned.